Joanna, I'm just looking at you. I would like you to bring your pants up so I can see your knees. I'm looking for alignment. Beautiful. Is there a way to tuck them into your waistband or even fold them onto themselves? Beautiful. Thank you so much. So you're just fine neutral. Perfect. So what I'm looking for is alignment straight through. Baby is looking more transverse right now, right? Do you feel like she is off to the left side a little bit, more slanted like this?
When I lay down, I can feel it better than with static.
It's okay. It doesn't matter, but that's what I am seeing. So I'm looking. Yes. So right now I am seeing her and I cannot tell if it's head or butt. I can just say one part of her is here and she's in this alignment right now.
Yeah. For my appointment, when they checked, her
Yes.
head was like over here.
That's amazing. So when a baby moves, that's great. She is trying to reposition, right? That's awesome. That's a good thing. So we are going to support her. So what I'm seeing is your alignment is mostly pretty good. Baby is definitely more of a oblique alignment right now, not straight up and down. I'm going to have you bend down to touch your toes and in whatever way feels fine. If you can't get down to your toes, that's okay. And we are just checking for spinal movement. I'm going to move your there and come on back up. How did that feel to you?
It felt fine.
Any aches, pains, strains anywhere?
No, it didn't.
Oh, good. I will have you do that one more time and go slow down and then slow up. I'm just watching how your spine moves. Perfect. Great. Beautiful. And I'm just going to speak. So what I'm seeing is a little raise on that right side. Come on up. So we are just noticing lower thoracic, upper lumbar. Yes. So that's what I'm trying to figure out. Where are your tightnesses? Because that will affect pelvic positioning.
Yeah, this is like more on this side, even when I'm standing up straight.
Exactly.
I think it's the way I was born.
Oh, could be.
I tried to get it fixed.
Sure, but that's what I am seeing. So again, I'm just making these observations for myself because that feeds into your pelvic position. I just want to try and get everything as stable and as balanced as possible. So hands on your hips for me, please, Joanna. And without shifting your feet, I want you to turn, rotate. I'm checking for spinal motion. Yep.
Like turn my body?
Yep, you got it. Exactly. You are so flexible. I want you to now go slowly because I'm going to check again segment by segment. So turn slowly one way. Beautiful. Keep going. Oh, wonderful. And come on the other way, please. Great. Beautiful. And you can come back to center. So what we see here is Joanna is really flexible, right? Your spine moves really well. That's wonderful. So no concerns there. So we have a client standing. We are going to have her keep her feet nice and hip width apart. So spread them more actually, Joanna. Nice and wide. Beautiful. You can widen them a tiny bit more. Yeah. There we go. Can you go a little bit wider? Just a tiny bit. There we go. Come back towards me. Oh, beautiful. Draw this leg in. No, draw this leg in here. Oh, that's okay. Relax. Perfect. That's good. Yes. I'm going to have my hand right here on the sacrum. Is that okay? Yeah. I'm going to mobility check it. And you are right in lunging because I will soon ask you to lunge forward into this knee. So go ahead, lunge forward and then come back. And then I do the same thing on the other. Beautiful. And then I may ask you, Joanna, rotate this leg out. Yep. And then you lunge sideways. Yep. Exactly. And back. You got it. So depending on what I find, I'll tell you to lunge straight or sideways. Okay. So let's start straight. You got it. So this is me placing my hand here. My one hand is going to go on your pubic area. Is that okay? Perfect. I'm just checking for tension. If anything feels off, let me know. Inhale into the low belly. Good. Lunge forward into the left side, please. Lunge forward. So no. Just like you did, just lunge forward with this. Here, Joanna, I'll show you. I'll have you straighten up. So straighten up. Look at me. So this is me lunging forward. This is lunging sideways. So when I say lunge forward, just bend this knee and go forward. So my hip is also going forward like this. Okay. It's like you're bending and twisting. Okay. That helps me check that. So bend forward. You got it. Perfect. And if I say sideways, then you will just rotate this leg. So rotate this leg out and then go sideways. You got it. Yes, this is a great position to loosen those hips up. Can I do that? Both sides and yes, front and side. But let me just do what I'm doing. Let me adjust you. So I have one hand on Joanna. I am going to stack here. Good. I'm going to put one hand on your belly. Is that okay? Mm-hmm. So I'm noticing she has a little bit tension in the left side of her pelvis and also in the left side of her belly. And which makes sense. That's where we had seen baby's head. I am gently engaging the left border of her abdomen and stacking that there. Good. Inhale into the low belly for me, Joanna. Good. Lunge forward into the left leg. So forward, forward, forward. Good. Stay here, please. Stay. And now straighten back up. Good. Exhale, go. Good. Did you feel a change in your muscle here and in your belly? Did you notice any change?
I don't know. I can tell it's tight.
Do you notice how baby is not pushing so hard against this side anymore?
Oh, yeah.
Right? So she actually just shifted. So it wasn't me doing the shifting. It was me getting the exact release and you moving. And you breathed into relaxation and baby moved. So,
She moved?
oh yeah. You could tell she moved, right?
No, I can't.
Can you feel that she's not pushing anymore? So straighten up. See how she was pushing so hard into this side? Do you feel that anymore?
No.
Exactly. She moved. Yep.
It gets
It's
all
good.
tight. Sometimes
That's
my
her
whole belly
moving.
feels tight and
Yes.
I just never know exactly where she
Yes.
is. But yeah, it feels like...
Awesome. So she will move. This baby, I think, is going to move. I think she will flip, but we need to do some things. So let's do a couple more. So her head was up here. Now her head is here.
It is? Okay.
That's what I feel. So again, I'm not a midwife, so I cannot exactly palpate, but I could feel
feel
something
that
round
Yeah.
and then it moved down.
Down. Yep. She moves a lot around.
So that's the other
from
thing,
side
right?
To side
Yes.
up here.
So
but she stays
that's a
kind of-
good sign.
Yeah.
But so what we need to do then is that because then there is something that's not opening the door. Your pelvis is like the door is not open yet, baby. It's not letting her in. So my question to you is why is that door not open?
Yeah.
And it can be...
She just moved again. Is there something
Good.
right here though? I don't know.
So
For
is it
hips down
feeling
here.
okay now? You're feeling okay, right? You're
Yeah.
not feeling bad. Nothing feels off, right?
No.
That's good. Because also moms will sense if something's wrong with the baby.
Yeah.
I always warn moms because some moms will start worrying like, oh, is this bad for baby? No, she is moving right now. You can feel that, right?
I feel
So
like her head is right here though.
do you mind facing the camera? So what we are noticing is that even with that just one maneuver, I'll have you turn there, that Joanna's belly is a little tighter, right? It feels like it tensed up a little. Yes, and baby is shifting. We did notice a significant left bump earlier. It's a little softer, but we are going to keep doing our little adjustments and support your body as best as possible to get her better head down. Let's go back. Good. So let's stack this pelvis. Awesome. Breathe into that low belly. So what we're doing is we are creating space. Relax your shoulders, Joanna, and go ha. Exhale. Yes. I am again stacking the pelvis. And with respect to mom's left lower ribs, inhale into my hand by your ribs. Good. That creates space. Now lunge forward into the left hip. Good. Stay here. Soften your shoulders. Don't create tension. Think everything is open and soft and loose. Exhale, go and come back to your spot. Yes, good. Nice job, Joanna. Wiggle your bum. Yep, but good wiggles are good. Go ahead. How puppies wiggle their butt when they are happy. When we are happy and when we are feeling good, our muscles are loose, and that we can almost replicate in our body by doing that tailbone shake. It keeps the hips looser. So I can show you some exercises you can do. I'll have you scooch just so I don't step on you. So find your kitchen counter, a tall couch, like the back of a couch. You will relax with your forearms, walk your legs back, and you can just start with side to side. So I'm not even necessarily focusing on forward. I'm just thinking I'm going to my right hip. I'm going into my left hip. That's one. Second is going to be lunge forward. So this right hip is twisting forward and then left hip forward. So second one. Third one is just slightly different. Your feet, your toes point out 45 degrees and you lunge forward, just goes a little bit deeper and then you'll go nice and deep and you can walk with your hands. Can you try those? Your belly is already looking different.
So you said do this?
Yep. And this seems almost easy for you even. You move really well. That's great. Beautiful. Now lunge forward. Beautiful. Keep your heels on the floor. So don't lift the heel off on the right. Beautiful. Yes. So you don't have to twist. Remember, this is the third one, but that's okay. The second one is just straight bend and back. See how it feels different in your pelvis?
Look at that.
Do you notice how it feels different, Joanna?
Yeah.
It hits a different muscle group. That's all. Yep. That's the second one. The third one is a twist where you go.
twist.
Yes, but it's also with the foot pointing out. Yep. Both feet point out. Yes. Or nice. Yes.
Is that right?
Yes. The fourth one is that lunge where the feet stay at that 45-degree angle and you really lunge into one side. And yes, you walk your hands. Exactly. Beautiful. Nice. So again, I'll have you straighten up, Joanna. Can I look at you straight on? So yep, stay right there. Good. Face me. So we are just looking at Joanna's belly after we did some motion. And you can see that you can feel the movement happening in that left side. Could you feel it?
I could feel something in my curve.
She's shifting, right? She's moving, right? So that's great. So this is part of our breech protocol, and you will get the PDF, so you will be able to do it at home. We thread a sheet, a scarf, something like that, under the belly and into the hips. And your husband's job is just to pull diagonally upward, and you are going to go onto your forearms. Yep. And even sit back into child's pose almost. Yep. Here, that's good. So stay in, this is called a high puppy. In yoga, do you do yoga, Joanna?
I haven't in a long time.
And you can even straighten out your forearms all the way like child's pose in yoga. Yes, there we go. So this is the position we want to be in, with your spine nice and long. Your feet can be relaxed. Does this feel okay?
Yeah, I'm just getting a little bit of Charlie horse in my foot.
You're getting a tremor, you said?
A little bit of a Charlie horse in my foot, but that's fine.
It hurts, did you say?
It's just a little bit of a Charlie horse. Do you know what that is?
Oh,
Like
yeah,
muscles.
Charlie horse. Go ahead, rock back and forth. Yep. Do what you need to be comfortable. Yes. Can you not be in this position? Is it hurting?
No, it's fine. It's just my foot.
So
So
this
you
is-
just do that.
Yes, he just pulls. You stay here. When he pulls, you can do the side to side tail wag. Yes. Yeah.
And how long do you do this for?
You will do it for a few minutes. You should not get lightheaded, right? And he can even do a little shake to even your hips out.
Okay.
You can do the exercises in this position, meaning send both your hips to the right. So like go this way. So you're going to go like this, but stay here while he pulls straight up. Yes, bag like that. Yes, you can go, we call them pelvic rock bags. Go onto your hands. So go into tabletop, Joanna, and you will rock forward and back, and he will just keep the pressure. Yes, and rock back into child's pose almost. Go into child's pose. Yes, beautiful, nice. See how that opens up the front of your hips?
Mm-hmm.
That's what we're looking for. Good. And on the way back, you give it a little wiggle. Nice. Come back. Wiggle, wiggle, wiggle. See how much looser it's getting already? Wiggle. Good. And you can come back to center. Go ahead, relax. Perfect. Did you notice how that loosened up the front?
Yeah, a little bit.
Good. So I have my client here. We just finished like a 25-minute hands-on session. And as you can see, can you put the shirt up a little? Her belly now seems so much more even. When we first started, there was a significant bump placed up here under your left ribs. Isn't that right? You were feeling that? There was a hardness here. And now baby has moved and we are feeling the hardness here plus here. So I am not a midwife, right? We are not midwives, we are not OBs, so we cannot tell by palpation. But either baby's head or butt is now here. So baby has changed from an alignment like this to an alignment like this.